So the technique that I'm going to talk about is the modified pass technique. This is the most recommended toothbrushing technique because it cleans the tooth surfaces and also it cleans the areas in between the teeth. In this technique, you start from the last tooth and you place your toothbrush in such a manner that it is at a 45-degree angle with the bristles of the toothbrush partly on the gingival, on the gums and partly on the tooth. Very gently you give to fro movement and you sweep it down. This is different from the horizontal toothbrushing because horizontal is this way, which is not recommended at all. It is very harmful to the tooth, so it's not recommended. So in the modified technique, again you take it at a 45-degree angle, partly the bristles on the gum, partly on the tooth, to flow down. This way you go around the entire dentation. Once it reaches till the end, then you have to go from the inside, similarly placing it at a 45-degree angle to flow down. Once this is done, the top of the teeth are cleaned in this way. Once this is done, the front part is cleaned by keeping the brush straight and pushing it down. Similarly, once the upper is complete, then the same technique is used for the lower. In that again, you place it at a 45-degree angle, partly on the gum, partly on the tooth, and sweep up. At least 2 minutes has to be given for toothbrushing. So once this is complete, the inside is cleaned in similar manner. Interior, keeping it vertical. You can move it this way and out for cleaning it in between the teeth and up. 45-degree angle and up. Once this is done, then the top of the teeth are cleaned in this way. Alright, I'm going to talk about a method which is known as the circular method of toothbrushing. This is very easy to follow. It is recommended for small children because it is easy to follow. In this, what you have to do is you have to partly close your mouth and partly keep it open. You just have to insert the toothbrush inside and you have to go a roll-on motion. There are two ways of doing it. Either you can take both upper and lower together, or you can take it separately. Similarly, you start from the last tooth and you work your way in the front. Start from the last tooth and come in the front. This is the circular method. Sometimes we also advise this method for adults, especially for people who are not able to follow the modified pass method because it is easy to follow. So either way, either you go like this or you partly open it, move, this way, and this, from the outside, similarly on the inside, roll on. Because this part is a little small, so it's difficult to insert the toothbrush and do the roll motion. So in that case, you can just move it horizontally in between the interdental spaces and pull it out. Okay, another very important aspect of your maintaining of oral health is cleaning of the tongue. With that, there are special kind of it's like a toothbrush which is there. It's known as a tongue cleaner. It has bristles on one side, it has a blunt end on the other. Depending on the patient, any side can be used. So imagine if there was a tongue here. This is used in a motion from inside to outside, single sweep, inside to outside. You never have to use the tongue cleaner in this way, because if you're using it this way, then everything that is accumulated, all the deposits, in fact you end up pushing it down back into the throat. So single motion, you use it from outside, from inside to outside, inside to outside, inside to outside. Either sides can be used. You can use it like this, inside to outside, inside to outside. So I'm going to show you flossing. Flossing is extremely important because it cleans the spaces in between the teeth, which we cannot clean with a normal toothbrush. Various kinds of floss are available, waxed, unwaxed. This is an unwaxed floss that I'm using. You take some floss. Lot of methods are there. What I prefer doing is you just wrap it around your middle finger, more on one hand, less on the other, because you want to keep one side clean and one side would be dirty. This much floss in between, which can be manipulated with your first finger and your thumb. Very gently, starting from the most last tooth, you insert it in. Never put the floss in like this because you will harm the gum in between the teeth. So very gently slide it in, form a C-shaped, clean it, again a C-shaped, clean it, C-shaped, clean, C-shaped, clean. Very gently take it out. This part becomes dirty because it will have a lot of deposits on it. So in that case, you wrap the dirty part on the other finger, unwrap the clean floss. You go again the same way, you go ahead, form a C, out, form a C, out. It's recommended that once you have put in the floss in between an interdental space, not to take it out to clean the other surface. So once it is in, clean it here, clean it here. Similarly, wrap it, unwrap, out. So 2 minutes for flossing of the entire dentition of all the teeth, and that's enough. Once a day is enough. If you can do it 2 times a day, that's very good. So brushing twice a day, flossing at least once a day, cleaning of the tongue twice a day immediately after brushing is recommended.